Undervaccination of babies 2 to 24 months of age is an increasing trend that's gotten mainstream medicine in an uproar. The mainstream doctors and scientists are accusing those parents who have undervaccinated babies of setting the stage for an epidemic that's a threat to the human race.
My goodness.
As a consequence, 15 scientists got together and they did a large study intended to show that babies vaccinated according to the CDC's recommendations would be healthier than those who did not follow the schedule properly or who did not accept all the vaccines. So what did they find,
Boy,
and what did they report?
they were very disappointed at the results of the study because they were so sure that that vaccines are the most important cornerstone of medicine in this century. And what they did is really a terrible thing. They ignored the fact that that's what they found, and what they said was that the study was about something really quite different.
They were very vague and general and tried to not fess up.
Didn't fess up because when you looked at the statistics that were right there, it was very clear about what the results showed.
So what were the results?
Basically, that the kids that were immunized didn't do as well. They had more emergency room visits. They had more
ER visits?
Emergency room visits, and they also had more visits to their primary care doctors. And there was no change in hospitalization rates there. So what they really found was it should have been disclosed. When you look at a study like this and it's done carefully, and then they come out with results like they do, it's like lying to us. And that's what we see so often in our journals today.
So let's talk about the two groups of the undervaccinated babies.
Okay. One of those groups was from parents who just never got around to giving their kids all the vaccines on time because they were busy or whatever life's reasons were that led them that way. The other group was of women or parents who were not going to give the vaccines because they had studied them and they felt like those vaccines were not the right thing for their kids. So there was a difference in those groups.
Because one group was concerned parents, and the other ones were just probably a little lax.
Not as concerned. And then the group that got all the vaccines also had parents that were concerned. So what we're looking here is a study on concerned parents. And the difference between the unconcerned parents and the concerned parents in terms of hospitalizations was quite significant. It was 20% more in that group.
I also thought that it was interesting that they didn't put babies in this study that had no vaccinations.
That's what they should have done. If they were really interested in knowing if vaccines work or don't, that's what they would have done. And it's one of the objections I've had about immunizations, Vicki, right from the start, is that why don't we just do the studies? Because neither one of us are opposed to vaccines. We think they're actually quite an interesting idea. But what we are opposed to is really bad science that where you're not getting data that's giving you the permission to say the things that you're saying except by proclamation.
I think what was interesting last year was that the children that got the vaccines ended up with a whooping cough.
Yeah, more than the
and
ones
now
that
they've been
weren't.
advertising the whooping cough vaccine even more.
It's the same thing with the flu shot. I mean, the flu shot this year is a total scam, just like it's been every other year that it's been out there. The CDC lies about the numbers. They even admit they don't know, but they still come up with a number. The World Health Organization is no different. I recommend you all go to the website, drsaputo.com, and look up The Infection Deception, which is a paper that was published that I wrote on that topic back in 2010 during that swine flu epidemic and showed what a scam it is.
Well, another thing is that there's like this elephant in the room where a lot of parents don't want their children to be vaccinated because they're afraid of autism. And a lot of these kids have gotten money through the courts, where the courts have shown that they felt that the vaccines were harmful. There's other considerations too, like Guillain-Barré syndrome and anaphylaxis and SIDS.
Well, those are all concerns, and until we have data, it's so easy to take one group of people and immunize them and another group and not immunize them, and then check on them over the course of the next year or so and see what happens, who's protected from the disease, how many side effects do you get from the vaccine, and is it worth it? That's not an expensive study. It's easy to do, and it would give us an answer. My question is, why hasn't that study been done?
And the Institute of Medicine claims that the vaccines are safe, and they don't have any research to back them.
No, that's a proclamation too. So I'm disappointed at the scientists who wrote this paper. I'm equally disappointed at the way the people who rewrote this paper because they felt like the public should know, because they only took the negative point of view on it. And I would agree that they pointed out that there were more visits to emergency rooms and to private doctors in the group that was under immunized from parents that were aware that they didn't get their vaccines because they didn't want them to have them, than the kids that were in the group that got all the vaccines that were supposed to on schedule as recommended by the CDC. But the other group, they also didn't point out that these groups weren't comparable because they were made of parents who had different kinds of a sense of responsibility for their children. So we have to keep a balance of both sides and realize that unless we really look at papers that come out like this in a way where we're really taking time to examine them and then see what they say and then try to honestly evaluate what they say rather than taking the extremes where we've got a war going on against the people in the mainstream with the people in complementary and alternative medicine.